In this video, I want to make clarifications between kidney disease, kidney infection, kidney issues, kidney cysts, and kidney stones. A lot of persons make mistakes when they get diagnosed of which particular one is their problem. So some of them I'm going to use common sense to also explain it to us, and some of them I'm going to be coming from the medical angle to be able to explain it to us. Like when someone tell you that someone is having kidney issue, it means that you're having a problem with their kidney. And kidney issue does not imply any particular kind of kidney problem. Kidney issue could be kidney failure, it could be kidney stone, it could be kidney cysts, it could be any condition at all that affects the kidney. Okay, now is that kidney issue is actually a layman's language, because medically there's nothing like kidney issue. All right, it's actually a layman's term that is used to describe something that has to do with the kidney. All right, someone in the group will be asking me, what can someone who has kidney issue, what can the person take? You don't know what the actual problem, so how do you think you can actually manage the treatment or the diagnosis of that person? So kidney issue is not a medical diagnosis. It's actually a broad term that is actually used to describe any condition at all that affects the kidney. It could be horseshoe kidney, it could be kidney cancer, it could be whatsoever you can actually say that it is. So secondly, people come and say somebody has kidney problem, and by the time they say kidney problem, what they actually refer to is kidney failure. All right, so what they're actually referring to is kidney failure, but this kidney problem can also be a layman's language of describing problems with kidney. So if you're trying to discuss with a medical practitioner, in order to be able to stress your point very well for them to be able to understand where you're coming from, you don't tell the person that I'm having kidney issue or I'm having kidney problem. Okay, so because when you say that, you're saying that you're giving them that the kidney has problem, but for someone that wants to manage you, this person will actually want to know what exactly is wrong with your kidney. Now another set of persons will come and they will say that what they are having is kidney disease. Okay, so kidney disease may actually sound more accurate medically. It can actually make more sense medically than kidney issues and kidney problem. But kidney disease on its own is an umbrella term that covers a lot of other kidney problems, like the kidney stone, chronic kidney disease, kidney cysts, kidney infection, and I can go on and on to mention issues that affects the kidney. So all of them comes under the term kidney disease. So when someone has kidney disease, it could also be nephrotic syndrome too. It's also a kidney disease. Kidney disease is now divided into acute kidney injury, chronic kidney disease, and we also have congenital kidney issues, and all the rest of them. So congenital in the sense that this patient or this person is born with certain abnormalities of the kidney, which might actually include what we call the horseshoe kidney I talked about, the atopic kidney, it could be renal agenesis, and all the rest of them. So what am I trying to say? I'm trying to say that we also have kidney issues that can actually be transferred and that can actually be dictated at birth. Okay, some people are born with it, they may not even know until they start having, when they grow up and start having issues with their kidney, they go to the hospital to do an ultrasound scan, and they'll be told that they have so and so thing. So I have a scan center where I operate here in the city of Abakaliki, Ebonyi State, Nigeria. So during our scans, one of our scan sections, we discovered that someone was actually born with one kidney. Okay, he has never known this all through his life. So it was in our place it was discovered. So he didn't believe it. So he went to other places and it was confirmed that this person has this condition. So it is also very important that once in a while you take your child to check the state of their kidneys. Okay, I don't want to go into stories because I want this video to be as short as possible. So we said we have acute kidney injury, which means that this kidney has been assaulted within the period of few hours. Okay, so these conditions, this person may actually need dialysis, may do 1 or 2 dialysis and will be okay. Okay, so and some of them may not be dictated on time, and it may progress to other very serious kidney issues like CKD and end-stage renal disease. So, and it is also good that I tell you that most of the time AKI happens within the hospital premises, especially for patients in the ICU. So, having said this, it is also very important that we now talk about CKD. CKD on its own is termed chronic kidney disease, and it comes in stages. We have the stage 1, stage 2, stage 3, stage 4, and stage 5. So stage 1 to 3, people who have this condition may actually be moving around unnoticed, okay, without bothering about what is happening to them. Meaning to say they will have this condition without knowing. This is why personally I advocate that once every year you should go for a kidney health check. Check your kidneys and know how far they are doing, so that whatever it is, it shouldn't scare you. Whatever it is, you should be able to know and start taking action on time. If you notice that your kidneys are failing at stage 3 or stage 2, one of the things that you can do is that you can actually take actions that would prevent progression. And this prevention of progression you can even delay kidney failure. If it was supposed to happen to you, if you didn't know at all, you can delay it for 3-5 years, and you can even delay it for life, and it will never happen to you all through your stay on earth if you are health smart. Okay, so it can actually affect your diet. You change your diet, change a lot of things about you, become more proactive about your health. You live as long as you want to live. So by the time it gets to stage 4, you now start making plans, like you know what you are up to. It can actually make you improve your hustle, so that by the time the decline is going into end stage renal disease, you can opt for what they call it, you can opt for transplant, get an AV fistula, and you will be fine. Okay, so I'm saying this to also empower you with knowledge, because they say that knowledge is wealth, knowledge is power. So I'm giving you the power so that you can actually make informed decision with them. And when it comes to end stage renal disease, that's what people call kidney failure. In CKD, that is the stage 5 kidney failure, also known as end-stage renal disease. So in a layman's term, it is called kidney failure. So kidney failure is different from every other thing I've actually mentioned. Remember I said there's the one we call AKI, acute kidney injury, where kidney failure lasts for a few hours. Okay, so and in these few hours, if the person does 1 or 2 sections of dialysis, the kidneys can actually pick up. So this is the time that people say that they have kidney failure and they survived. So that is it. So having said that, having made clarification about this, there is something we call kidney stone. Kidney stone is different from kidney infection, it's different from kidney cyst. Kidney stone is actually the presence of a stone in the kidney. What is the characteristic of a stone? One of the characteristics of the stone is that stone is solid. So it means that it can be, you will see a solid mass in the kidney. So it's not it's not an outgrowth. So it's not a growth in the kidney like a tumor or something. No, it is something that accumulates and form a hard mass and can be removed. So we have different kind of kidney stones. This is not video for it. So I just want to make this. If you want to watch videos about kidney stone, my YouTube channel and my page is full of a lot of things about kidney stone. So you can move around this channel or this page or this account to see a lot of things I've actually done about kidney stone. So we have kidney infection. Kidney infection, or some of your what do you call it, your scan results may have it as pyelonephritis, is actually the presence of an infective organism in your kidney. It means that an infective process is actually going on in your kidney. It means that your kidney is infected. Okay, I don't know how to describe infection, but you know that someone can actually have infection like UTI and STD. It means that this infection now is not happening to the kidneys. Okay, you need to get tested and start treatment with antibiotics, fluid, and little dietary modifications. All right, so we now have the one we call kidney stones, where you'll be told to keep drinking water. How many of us have drank water for a very long time? Okay, they will tell you to keep drinking water, or they will give you some better blockers for you to take. Okay, so these are the things that you need to do to actually handle kidney stone and kidney infection. Then we have the one we call kidney cyst. Kidney cyst is just like a boil. on top of the kidney, like they call it a fluid sac. It could be on the surface of the kidney, or it could be inside. Then when it comes to cyst, we have the one we call multiple cyst, we have simple cyst, and the multiple cyst is also known as polycystic kidney. So if you've noticed this, it's also important for you to know that single cyst sometimes can actually disappear on their own, and sometimes can actually start multiplying. And when you have polycystic, it means that it is actually genetical, meaning to say it runs in family. It means that if a family member from family A has polycystic, it means that A is more likely to have polycystic kidney disease. Okay, so we also have some of the sicknesses, some of all the sicknesses that we've termed genetic. Some of them can actually hide in a certain generation and surface in another generation. So which other thing are we supposed to talk about we've not talked about? So this is kidney cyst, and this is kidney infection, and this is kidney stone. So three of them are different thing altogether, so you don't miss it up. Okay, I don't know if I've been able to clear you on that. I'm Honorable Victory, and I'm your kidney health coach. And if you need any other clarification that you think I should do on this subject matter, please identify in the comment section, and the next video I'll be talking about it. Thank you very much. Please share, like, and subscribe, and follow.